We see a lot of preterm deliveries upstairs. It's related to, like we've talked about, maternal health. We have a lot of moms that have hypertension. Typically, low birth weight is defined as, regardless of gestational age, an infant that's born weighing less than 2,500 grams or about 5 pounds and 5 ounces. And what I've seen, some of the risk factors that have attributed to low birth weight are poor maternal nutritional health, limited prenatal care or lack of prenatal care, smoking, drinking alcohol, young teenage pregnancies typically will lead to low birth weight, sometimes multiple gestation as well. And some babies you have born at 35, 36 weeks, they will do well, but then you will have some babies who may have some oxygen requirements or may end up with other issues, as it relates to the newborn nursery period. So it just kind of depends on the course that they had to endure during the nurseries, meaning that if they required oxygen, if they had, other adverse outcomes, then that may correlate with complications on down the road, such as cerebral palsy. Sometimes they will have developmental delays.
So when we look at things like low birth weight, and particularly inequities within low birth weight, that's where we're trying to find where our outlanders children face problems. What's more interesting to me is the comparison between white children and African American black children. There at 9.1% of your white children are born low birth weight, and 32% of your African American children were born in 2018. That's a major difference. There's a lot of backstory on historic racism in medicine. We don't track that, but we do see the impact of a medical system that doesn't listen to black mothers the same way they do to other mothers in the data.
I think, first of all, identifying the issue that we have and then providing more education about ways to prevent low birth weight and having maybe educational seminars or ways that we can prevent them. It's a lot of education that goes into play every single day with our job. So